Welcome everyone. I'm Councillor Matthew Williamson, Cabinet Member Health, Wellbeing and Social Care. If the continuous fire alarm sounds, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. In order to comply with the Guildhall Trust Fire Marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. There's no members of the press and public in with us today. Please can everyone use the microphones and remember to switch them off when they are finished. Okay, so if we start with Lewis.
Afternoon, Councillor Lewis Gosling, Conservative spokesperson.
Good afternoon, Brian Madgewick for Portsmouth Independent Party at Paulsgrove Ward, and I'm an opposition spokesman. Thank you.
Thank you, Chair. Andy Biddle, Director of Adult Social Care at Portsmouth City Council.
I'm Richard Webb, Finance Manager for Adult Social Care and Public Health.
Debbie Young, Head of Quality and Performance for Adult Services.
Anna Martin, Democratic Services.
Hi Yinka, do you just want to introduce yourself?
A little bit. Yes, my name is Yinka, Councillor for Charles Dickens Ward, Labour spokesperson for Health, Wellbeing and Social Care. Thank you.
Thank you very much everyone. Yinka, can you just switch off your microphone? Yinka, you just switch off your microphone. That's right, thank you. It's just it messes with the cameras if you leave your microphones on. So no deputation requests, and we have no apologies for absence as we're all present. Members, do you have any declarations of interest at all? Okay, thank you very much. So moving swiftly on then, we have liberty protection safeguards. Over to you, Andy.
Thank you, Chair. So the paper in front of you in the brief summary section talks about the origins of the LPS and what they're there for, and also talking about the main impacts on our citizens in terms of extending liberty protection safeguards to young people aged 16-17. And including applying these safeguards to people who live in their own home, whereas previously it would have been people that lived in some form of institutional care or were staying in hospital. So just to summarise the paper, the scope of the paper is set out in sections 3, 4 and 5, along with the legislative framework and the precedent that created deprivation of liberty safeguards as the predecessor to liberty protection safeguards. Apologies for the number of acronyms. And then the pathway to the review of those doles arrangements which have created LPS. Moving into section 6, that sets out the current process for doles in Portsmouth and gives some detail around the staff that are engaged in working in that process. And the number of referrals that we have. The next section sets out the key differences, so that's on the base of page 3 under section 8, sets out the key differences between the doles and LPS processes and arrangements. And then moving over into section 9, gives highlights of the work programme that's in train to prepare for the change from doles to LPS and some of the new roles that will need to be created. Whilst it feels in some cases like an administrative change, the work behind it, given there'll be a new code of practice, people will need to understand it. They'll need to understand it for their own purposes and the jobs that they do, but then they'll also need to be able to explain it to our residents and those people affected. There's quite a lot of work to do. It's quite a substantial work programme to deal with. The section 9.3 sets out the new responsible bodies. That changes slightly in that there'll be more involvement for our NHS colleagues. And the other part that I mentioned at the beginning, there'll also be a lot more involvement for our children and young people's colleagues in children's social care, which there hasn't been up to this point. talks about, at the base of page 5 there, independent mental capacity advocates, which is not changing a huge amount. There was always a provision for advocacy within the DOLS and within the Mental Capacity Act itself, but is a really important point for people who are unrepresented. And we then go on in section 10 to talk about the financial implications. It's estimated by the government that the move from DOLS to LPS will save money. That's not proven yet because we haven't made that move. We're not quite clear around what the national funding might be. It should come under a new burdens doctrine. Whether that does end up saving money or not, I don't think we've got any evidence of that. If it works as it's purported to do so, then possibly. But as I say, we're not really going to see that at this moment in time. That's going to take a while to come through. And then finally, in section 11, we talk about the potential time frame for LPS. It was due to be implemented in April of this year, but we had COVID pandemic. Many things were delayed through that, as I'm sure you'd appreciate. The last interaction we had around this was a consultation on the draft code of practice, which closed on July of this year. We were anticipating that the earliest date that liberty protection safeguards could be implemented would be October of next year, next calendar year. And there was a report that came out earlier this week that from Social Work England, the regulator, that seemed to confirm that. But then we had counter confirmation yesterday from the Department of Health and Social Care that no date had actually been announced. So as it stands currently, we still don't know when this will be implemented. We're in train to do the work. We have somebody to manage the project appointed within Portsmouth, working with all relevant parties. And when we get any update as to implementation date, then we'll bring a further paper back here for information. So that's a summary of the paper. You've also got some appendix attached to it, which give a bit more technical detail around the changes from DOLS to LPS. As always, happy to take any questions.
Thank you very much, Andy. Colleagues, Lewis.
Thanks, Andy. Just one question around the numbers that are currently going through the DOLS programme. I just wondered if the number that we've got in there for last year looks normal, or if there was a spike post-COVID, or if anything like that, and how that's going to affect the work moving forward.
Thank you. We've seen, ever since DOLS was introduced, we've seen the numbers going up each year. There's a difference between the numbers of people, citizens referred for a deprivation of liberty assessment, and the number that we end up granting normally. We tend to grant around about 75%, I think. I won't be exact with that, but that's roughly it. We did see a slight increase post-COVID, but because we've seen a ladder of numbers increasing, it wasn't really that huge a difference. I think the key, both with DOLS and probably with LPS, will be how good we are, all of the agencies involved in Health and Care Portsmouth, at educating people, at educating our citizens, that where there's certain arrangements in place that constitute a deprivation of liberty, we should take account of them and make an assessment. And I'd like to think that the increase in our numbers speaks to that education. So I would anticipate they will go up, because I think we currently, under DOLS, we have to make a referral to the court if we've got someone who's deprived of their liberty in their own home. LPS means we don't have to do that, we can apply a process. And so theoretically more people will come under LPS. There could have been a nervousness or a reluctance in the past because DOLS didn't apply. So I think we'll probably see increases in that direction as well. Even things like using, for instance, putting a bolt on the top of a door, what they might call a baffle lock in previous times, could potentially constitute a deprivation of liberty. So I think as people begin to realise that more, I think we'll see an increase in numbers. We've been lucky in Portsmouth in that we've got quite a dedicated workforce, and so we haven't seen the huge backlogs that a lot of other authorities have seen, particularly some of our colleagues in county authorities. That will probably come under pressure if we see numbers continue to increase, I think, on this trajectory. I hope that's helpful.
Thanks, Lewis. Thanks, Andy. Any questions, Yinka or Brian? Yeah, Yinka?
Andy, thank you so much. The only concern that I have here, I know this LPS is okay in terms of it applies from the age of 16, which is good, but the only concern is this financial implications. It's good to know they will save over 200 million, but is it going to be the quality? Is it going to be as when the door is in place? Because, you know, when they're trying to cut, we might get something lower in quality. So is it going to be the same quality as when doors is in place? Thank you.
That's a difficult one to answer. I think that from my assessment of the situation, the quality of practice generally is good. And there is a very specified process for DOLS, as there will be with LPS, in terms of the assessments, who can complete the assessments, the format of those assessments. I think the difficulty with the money question is more likely to be how timely can we be. I suppose it refers a little to the earlier question. If we do see a significant increase in numbers, and if we don't have the resource to do those assessments in a timely way, then I think quality necessarily does dip, because you need to be fairly prompt in responding to people, because otherwise there's an unauthorised deprivation of liberty happening. Quality of practice is a key question anyway, even under DOLS, because it's trying to ensure that all of those involved who might identify someone as being deprived of their liberty are clear and comfortable and confident in what their role is in that. So just as an example, we see quite a high turnover in our nursing colleagues at the moment, for instance, at the acute hospital. So you can put on a lot of training and development, but if you've then got turnover, you've got to have quite a regular programme updating. And I'm picking the hospital out of the air. There's a lot of other environments that'll be the same. So I think the key about maintaining quality in assessment is maintaining familiarity, confidence and competence with the assessment process and with identifying a deprivation of liberty. I think that the real risk is if we see an increase in numbers that we haven't got the resource to respond to, and thereby we see delays.
Thanks, Andy. And thanks for the report. It's really good. I think we've been working on this for some time now. And obviously, as you've mentioned in the report, it's been delayed via COVID. And obviously, it's a national delay, and all local authorities have had to move on it. But I think I'd like to thank your team and all the staff involved for the preps we're doing. There's been quite an investment from us in the work we're doing and will continue to do going forwards. But I understand as of yesterday, we've had the government tell us that, so this is a hot off the press, that unlike in here where it says the earliest that LPS will be implemented in October 2023, as it says in 11 here, that actually the government response yesterday was, oh, we didn't say that. So I think we have absolutely no idea now when LPS is going to come in. So I would really hope that the government would be coming forward and letting us know as soon as possible, because the work that we do on this, we will continue to do. But obviously the work in implementing it, the longer that's delayed, the more we still have to prepare for it. Because whenever it's going to be, you need to make sure it's everything in place, but you don't want things in place where people are just effectively going to be not implementing it. And I know from our colleagues around in the rest, not just within the council, but elsewhere in the health and social care sector, whether it be statutory, private or voluntary community sector, are really going to struggle with this in terms of, because they've got to be able to plan as well. So I really would hope the government would actually give us a date and hopefully the new Secretary of State now is in place, and hopefully he won't be around, he'll be around for a bit longer than the last one, will actually be able to give us some clarification there, because the implementation it has, and the implications it has rather, on us. And obviously, as has been brought up about the financial thing, we also need that clear financial thing. So obviously that would be my call on the government as well, to ensure that we have that. It's clear about what our finances are going to be, what the date of our implementation is going to be. I know wherever that's going to be, we're going to be ready for it, and I think that report absolutely makes that clear. It's clearly a positive thing. I think the new liberty protection safeguards, I think it's a move on from, I think what we could probably say was it was in response to a court ruling. So I think it was a little bit kind of, well, we need to have something in place. I think if you thought it through from the beginning, I don't think he's ever had doles as how it is. But obviously this has been something that's been years in the making, and so therefore is a really good point. But I think this, as I say, this does give a really clear pattern of what we're doing, and obviously when we know more and when we have dates and moving on with the project, the results of the feedback that we've the consultation and everything, that I look forward to like this coming back, and then hopefully that then we'll have everything together and we'll know exactly when we're going to be implementing, how we can support our partners in this being implemented, and everything together. So thanks a lot for that. Very happy to note that report. So the next one is final item on the agenda is adult social care assurance. Over to you again, Andy.
Thank you, Chair. This report details the focus of the paper and relevant dates for go live in terms of local authority assurance for adult social care, and the assurance stroke inspection focus is part one of the Care Act and how the local authority delivers its duties under that legislation. So Section 3 highlights the policy and the statutory background to the assurance of the delivery of the Care Act duties by the local authority, and the objectives moving from 3.2 over the page for that inspection, to understand that local authorities can evidence that people have choice and control and support to live independent lives, have access to quality care and support, and have accessible care and support. So the underpinning policy is listed there under 3.2 around created through the Health and Care Bill, and the Health and Care Act, as it became under 3.3, was enacted in April. So that's the background to coming to the point of assurance inspection for local authority adult social care. So in Section 4 and 5, this sets out the parts of the Care Act that are relevant and the framework that we believe CQC will be using for assurance, with the 5 key questions, and also lays out latterly some of the preparation that we're engaged in for inspection assessment, and our issues around investment in resource and capacity to be able to achieve that. So we've adopted, as it says in 5.2, we've adopted a number of tools to support our understanding of risk. We've been working in conjunction with our colleagues in the Association of Directors of Adult Social Services and the Local Government Association, because this is obviously a national programme, so we're making use of something called sector-led improvement, working with colleagues, so we're trying not to reinvent the wheel and use good practice from other places. There is a risk, as is detailed at 5.3. The last time we had any kind of national inspection of adult social care was around about 2010, and leading up to 2010. And so over time, in responding to the financial situation we find ourselves in, it's fair to say that we don't have the resources that we once had when we were subject to regular inspection. So that's a risk for us. Moving over to the latter part of Section 5 and in Section 6, so this details the areas of risk mitigation, including practice, quality, process, and the varied elements of data management. that require improvement, and Section 6 also draws together the importance of good governance. So not only do we know how we're performing, but we can tell our elected members and our council corporately how we're performing. Then moving into Section 7, that sets out the priorities in working toward being inspection/assurance fit, our next steps, which focus quite a lot, this is on page 7, which focus quite a lot on communication. Whilst the framework that CQC are using, if you look at it, it appears quite intuitive and you think, yeah, that seems to make sense. Ensuring that our colleagues understand that, ensuring that we're briefing our stakeholders and partners in Portsmouth around that, who will also be called upon to give evidence, if you like, around how we deliver our Care Act duties. Ensuring that our information technology is up to scratch to be able to prove those things that we're doing, and ensuring that we're running this as a project, so it's an organised and ordered progression towards being, as we might see, inspection fit is really key. I think one of the things that's worth, or a couple of things that are worth drawing out from the report, the first is our engagement with our children's services colleagues. Children's social care and education have been subject to quite structured inspection for a great many years, and it would be foolish of us not to try and learn from them in terms of how they manage that process and they get the best from it. I think the other thing that's really key is, whilst this is it's fair to say this is a burden on the resource that we have and that it'll involve a lot of work that we don't necessarily have a resource for, it is also a clear opportunity not only to demonstrate to ourselves as a local authority how we perform and the services that we deliver and how we serve our residents, but also to demonstrate to our residents themselves. The really important part about this whole inspection regime is that people who have lived experience of using services and lived experience of caring for people that use services in our city will be part of that evidence base that CQC seek. And we've encouraged that as local authorities when we've been talking to CQC about how they inspect. So whilst there's a lot of work to do, I think there's a lot of burden in terms of the resource that we need to allocate to it. There's also some really positive, there's an opportunity here as well. So that's a summary of the paper. Happy to take any questions.
Thanks very much, Andy. Any comments or questions? Lewis?
Just a comment really from me, just to say thank you again for the paper. I know it's something we've talked about quite a few times now. I know I've said it previously, but just to re-echo, I think the agenda today as well shows the amount of legislation change and the amount of changes that as a sector has been going on over recent years, plus if you then add COVID on top of that. So to actually be at a point now where we can almost step back and look at the services we're offering, as much as that puts a burden on us, I think is a good burden to have, and we've been so busy doing for so many years now that there are some things that you will have been missed and won't be as fabulous as we want them to be, for no fault of anybody's, just because we've been so busy doing everything else. So I think it's a really good process to be going through.
Thanks, Lewis. Any other questions? Oh, Brian.
Yep. It's actually private at the moment, so I can't go on air. You know that I want to come and meet you anyway to do certain things. But I've got another important question, which has got to stay private. But I'd like to ask you afterwards if you're available. Okay. Thank you, Andy. Thank you, Mark.
Thanks, Brian. Yinka, anything from you? Okay. Thanks, Yinka. So I'd like to thank Andy for presenting and Debbie for doing the report for us today. And again, I think Lewis has sort of made that point. I think one of the things that COVID did was it compressed a lot of things that had been delayed from COVID that might have been staggered to effectively meaning we have to do them all at once, and there's other bits and pieces going on as well on top of this, not least to do with the new integrated care system and all the things around that and the differences that makes. So everything I know has come at once, which has meant an awful lot of investment for us as a council to make sure that we can meet those challenges. But I think this is, again, the prep we're doing is absolutely necessary, and I think the team's doing that, and this paper really just sort of shows that we're not just going in here just to sort of tick some boxes, but as Andy said, making it clear that we're looking for opportunities as to how to improve our care sector in the city, not just within the city council, but with our partners outside, but also looking at what we can learn from our colleagues in children's who have been subject to intense inspection endlessly for many years. But I think it really is clear, as the report sets out, that this is something that we've effectively had to come from in terms of resourcing, etc., from nowhere. It's 12 years since the old inspection regime ended. So this is a completely new thing. We've got a lot of staff who have never worked under that regime at all. And therefore we can't just reactivate teams or anything. This is something we're having to completely recreate. And obviously the regime this time is different even to what was there in 2010. So yeah, Lewis is absolutely right. I think showing that there's a lot of work to do. It's all sort of come at once. We've had to do it, and obviously working with our partners, working with our fellow local authorities as well, because we're all going through this with liberty protection safeguards, with assurance, and I think that's just a really important thing. I was just going to ask Debbie actually if there's anything else she'd want to add in terms of just about like that prep and also you know how she feels that we're on target for 2023 for April.
Yeah, so in terms of the preparation, I mean, everybody's really engaged in the directorate, which is great. And as has been said, it is a really good opportunity to sort of showcase some of the stuff that we're doing, but also apply some scrutiny to perhaps areas where we think, actually, do you know what, we want to do that a bit differently. So I think that's great. I think the biggest concern, and it is kind of highlighted in the paper, is about the cost of this. So although it's something we should be doing anyway, effectively it feels like a new burden because it hasn't been done for such a long time. And certainly what we've heard today is DLUC aren't seeing it as a new burden. So money will be invested in sector-led improvements, so through ADAS and the Local Government Association, but is unlikely to come down directly to council. So that's something obviously that we will need to consider. And I think the other thing, what's been shared to date is an interim framework, so we don't yet have the final framework. So we know that secondary legislation is likely to go through in January of next year, but until we get the final framework, we don't know whether we're heading for the 1st of April in terms of our planning, but obviously there could be a question mark in terms of whether April will be the date. So we will continue as we have been, but it is a concern that at this moment, sort of 6 months or less than 6 months before the 1st of April, we don't actually have the final framework. So that's kind of probably the only things that I would really want to add. So thank you.
Thanks very much, Debbie. And yeah, I think that's again. I don't think the chaos in national government has really helped us here, because it has just put back those some really important things, not least in adult social care. Sort of dates for the LPS coming in. That thing about the framework, etc. We could really have done with that before now, and of course potentially then it could be put back as well. I think just one last thing as well would be really to just as a plea to the government, and I think it might be something that myself and the council leader and to be honest, if any of the opposition spokespeople want to sign it as well, I'm sure we would all do a call out to the government to say, and we have a cabinet minister, of course, in the city, to really put out that call about some of these new burdens for adult social care really do need addressing. And or we're going to get a proper funding package that's actually going to give us what we need going forwards, because I think one of my real concerns more generally is that what we hear from the Chancellor and the government and the Prime Minister at the moment is about they're looking at cuts, and if they're going to fall on social care, to be honest, that's going to be really, really tough. And we are in Portsmouth in a relatively good state. We all struggle, but we know we are, as a council, in a relatively good financial state. So it would be a burden on us. It would be a difficulty on us. However, for some of the other authorities around the country, this could really be extremely difficult. And that really concerns me as well, because obviously when we're working with local authorities, when we're working with our colleagues across the country, and we obviously have people who move to and from authorities, that if we have, say, someone who moves from Portsmouth to an authority who is really struggling financially because they're not getting the money they're getting, then I think we're letting them down as well. So I think it's the onus on us, and I think what I take away from this is we've got a new government in place now. We've got a new Secretary of State for both health and DLUC. We've got a new Prime Minister. We've got a sort of new Chancellor. I think we should sort of be doing that call. I know myself and Andrew are at a conference this week for adult and children's services. I'm sure those calls will be going from everywhere from local government, no matter what party. I know we speak for local government with one voice on this, and very much we should be going forwards. But I think that everything coming together now and what we have to provide, there's almost a tendency of thinking that, well, we won't fund that because it will do it under something else. But if the funding doesn't come in, instead it's cuts, then that's a real problem. So thank you so much for the report. Thank you for all the work you're doing, Debbie, and your team. And obviously we look forward to seeing exactly what the framework's going to be as soon as we get it. And obviously we'll work with the opportunities this arises for us, and obviously work to do the very best for the people in our city. So very happy to note that report. And that concludes the meeting, ladies and gentlemen. Thank you very much.